Is an internal pelvic floor examination necessary to get a true pelvic floor dysfunction diagnosis and also necessary for treatment? Hi, my name is Dr. Kaylee Simmerman, pelvic floor physical therapist. I'm the owner and founder of the Hope Doctors Pelvic Floor Physical Therapy here in St. Petersburg, Florida. And I'm here to chat about this because it's kind of the new topic online. Everyone is talking about it. Everyone has something to say. This is my son. He's actually the real boss. There's his car. And his birthday is coming up. So he's been very excited about all the new monster truck things he has. But we're super excited to talk about this today because, again, it's kind of like there's always these polarizing like comments that you see online. And recently we're seeing an internal examination is gold standard, absolutely necessary for you to be a pelvic floor physical therapist, or you have no internal examination is necessary at all. We can get you the same results online. So I'm here to talk about it because, again, let's get it straight. Let's talk about it. You need to watch out for that hot coffee, okay? I don't want you to spill it on yourself. So we want to talk about it because, again, like, how do you know? How do you know if you need it? How do you know what's not needed? How do you know who to go see for the certain things that you have? So here's like the basic level what I feel about this answer. The answer is it depends. Is it necessary? It depends. Is it something that is gold standard? I believe it is, and here's why. An internal pelvic floor physical therapist, internal pelvic floor occupational therapist are the only professionals that should be able to do an internal examination like that, which is what sets us apart. It is what gives us the opportunity to give you an actual grade or stage of a pelvic organ prolapse. It is what tells us what your urethra is doing and do you have urethral insufficiency, hypermobility, those kinds of things. It is what tells us what those muscles are doing. Can you contract? Can you relax? What's the coordination? Can I get same or similar results without doing an internal examination? Possible. And I have done it in the past because, again, as a practitioner, I do both online coaching, I do telehealth, and I also do internal or in-person pelvic floor physical therapy. So I personally believe it is a very helpful tool. It can give us a lot of information. Now, you know that my specialty is pelvic organ prolapse. Prolapse is really important to me. As someone who lives with it, it's actually really important to me that I get the right grade. It's important to me that I understand what that means. I don't know what type of prolapse or where the prolapse is or what the significance is if I don't see it, right? And if I don't assess it. And yes, I can still get you some results. I can still help you manage the pressure. I can still help you with finding the right exercises and movements to help you have no symptoms or be symptom free. It's just really, really, really important that you understand that. So there's a time and a place for an internal examination. There's a time and a place for online work, right? So again, it's such a nuanced thing. These things you're seeing online where it's like, yes, we need it. No, we don't. There's no nuance. And that's unfortunately exactly what our field of healthcare is. Like pelvic floor therapy is nuanced. It's very nuanced. Everyone needs something different. The whole purpose of doing what I do is individualized care. So each person does not need the same thing. If you come into my office and you have a lot of trauma and a lot of anxiety about internal examinations, of course, I'm not going to force it upon you. It's not going to give me more information than what you're already telling me with tightness, you can't penetrate, those kinds of things. Do I eventually want to get that assessment? Yes, I believe that's also valuable and very important because that is how we're going to stage or grade objection or not objections, but progress. And like, have we progressed from this dilator size to this dilator size? And if I don't know exactly what's going on, I can't teach you exactly what muscles are like resisting, what's going on in the pelvic floor, and all of that, right? So I do believe that the internal examination is what sets us apart from personal trainers or people throwing programs online just to sell them, right? Like I have all of that too, but I still believe that there is a really, really helpful time and place for us to utilize an internal pelvic floor examination. And you can still get a lot of results online without showing your vulva to anybody, right? Like you don't always have to have that. I don't believe that every session you see a pelvic floor therapist at, I don't believe that you always need internal work. I don't believe you need 30 minutes of that. I think maybe 10 minutes max if you need it to reassess, to check in, to see what's happening, what's progressing. So many of my clients come in for their first session. We get a true diagnosis. We do like a 10-minute pelvic floor assessment. And then let's not block my face, okay? 10-minute pelvic floor assessment. And then after that, they choose to do virtual because they live an hour away or their life is busy. They work from home, whatever that is. And that works great because I know now what the pelvic floor is doing. And I feel confident in my skill, my expertise, that I can give you a program that's going to help you get to exactly where your goals are. If I meet somebody for the first time online, it's a little bit harder. It's a little more difficult for me. I have to base that knowledge on movement, function, strength, which is great. And I love it. And it's so important. And we absolutely need it. And you'll get improvement. And you'll probably get the same results at some point. However, for me as a clinician, I'm going to be able to give you more individualized care if I see the pelvic floor first, if I know what the pelvic floor is doing. And so it's really important to understand, again, like, it's dependent on what you need, one, and it's dependent on the practitioner. Like if you do not want internal work at all, like you actually don't care what stage of prolapse, for example, you have, you just want to work on exercises. Hey, no more. You just want to work on exercises and things like that in order to improve the symptoms, but you don't actually want like that individualized approach. Fine. Like absolutely, we can do online work. This is coming from somebody, by the way, who works online with people. And if you're looking for a pessary fitting, or if you think that might be in your future, if you actually want to know the stage and grade to know exactly where to go next, that's where an internal exam can be very helpful. I've worked with people all over the world and coach them on how to figure out, we go through self-assessments, very powerful tool for those that have trauma histories, don't want to have like internal work, can't come in, or they meet me online and then they want to work with me. You get such incredible results there too. And so I'm here to say that there is no way that's like the best way. It's very dependent on who you are, what you need, and it's dependent on the provider that you're choosing. If you call and they're like, no, we have to do internal work at every session, always, XYZ, run away, because they're not going to individualize that approach. That's just the way that they know. If you call someone like myself, I'm like, it depends. I don't know. Like, let's hop on a call if you want to do virtual. Let's see what's going on. Let's get you in the course first. Once you go through my course, how are the symptoms? Are the symptoms changing? Are they worse, better, whatever? How can we move on from there? How can we individualize this and make it work for you? That's what makes a pelvic therapist. That's why we're different from personal trainers. That's why we're different. We have a doctorate level degree to be able to individualize care, to give you exercise, specific strength training, coordination, pressure management, all the things. That's not just a program, that we can individualize it and make it for you. If that's what you're looking for, look for a pelvic floor therapist that can actually do these assessments. If that's not what you're looking for, that's enough. If that's not what you're looking for, and you're looking for just something quick to do at home, and you're looking for a program, you don't actually have severe symptoms, and you don't need to know what those sessions look like, then that's great. Find the trainers, find the people of the pelvic floor. I always recommend looking for one that collaborates with a pelvic floor therapist, or that works on their own and has their own online programs, because just the knowledge that we have of being able to do these things, but just also know that it's a lot harder to diagnose a symptom online than it is in person. And so you may not get that accurate diagnosis or that full diagnosis, right? So it's really just dependent on where you are, what you need, what your belief system is, what you're comfortable with, and also just the provider. Like, what is the provider's ethos? Are you choosing someone who only feels like internal work is the only thing that they can do? Are you choosing someone like myself who's very eclectic? I will make it work for what you need, because that's what I'm here for. It's just really important that you understand there's nuance when we see these like polar opinions online. So again, to answer the question, do you need internal work or an internal assessment for a pelvic floor therapist? Personally, I believe it's very helpful to get a true, accurate diagnosis and then to understand what your plan of care needs to look like. Can we get results online? 100%. Can we get results through a program? Absolutely. It works best if we learn how to put them together, and if we learn how to utilize those tools to teach you how to do a self-assessment, for example. So I treat a client who's in Guatemala. I taught her how to do a self-assessment. I taught her spouse how to like walk through that with her. They did that as homework, came back, we talked about the results. Was it the same and was it as accurate? No. However, it's still something that was really, really helpful for her to learn. She has a lot of trauma. She has a lot of pelvic pain, did not want and could not tolerate internal assessments anyways. So what better way to be able to teach her about those things, right? So that's my spiel. Hopefully that answers your question. I'm open to having conversations, but good, find the provider that works for you. Find the provider that's able to kind of tailor all of the needs towards what you need, not just because they're selling a program. Make sure that you are sifting through their education and understanding where they're coming from. It's really, really important, okay? Because yes, they both can exist. Yes, they both can give you benefit, but it really depends on where you are and what you need, and that's how I would make a choice.